Insurance Claims Processing Training Presentation. Welcome new employees. As a new employee, we are providing you with this training program so you will understand the way we perform our account receivables, billing, and collection policies. Let us take you on a quick overview of the insurances, basic billing, and collections. Different insurance health plans. HMO, Health Maintenance Organization, delivers all health services through a network of healthcare providers and facilities. The least freedom to choose their healthcare provider and least amount of paperwork. Their primary care doctor manages their care and refers them to specialists. PPO, Preferred Provider Organization, more freedom to choose their healthcare providers and don't need a referral. Higher out-of-pocket costs to see out-of-network doctors. More paperwork when they see out-of-network doctors. EPO, Exclusive Provider Organization, more freedom to choose their healthcare providers and don't need a referral. Not coverage for out-of-network providers, they pay full price, lower premium. POS, Point of Service Plan. This plan blends an HMO and a PPO. More freedom to choose their healthcare provider than an HMO. Some paperwork to see out-of-network providers. Their primary care doctor coordinates their care and refers them to specialists. Medicare Part A, B, C, and D. Part A is inpatient hospital, critical access care, short-term care in a skilled nursing facility, nursing homes, or long-term care, a home insurance. Patients don't pay for this. Part B is medical insurance, covers doctors, outpatient care, some preventative services, occupational and physical therapy. Patients over 65 pay for this monthly. Part C is an Advantage plan which takes the place of Medicare Part A and B and offers a prescription drug plan. It can be a PPO, HMO, or private fee for service plan. Part D is the prescription plan that the patients pay extra for. Medicaid. Medicaid and Children Health Insurance Program, CHIP, offers free or low-cost health coverage to low-income people, families and children, pregnant women, and the elderly, and people with disabilities. Services include inpatient and outpatient hospital services, physician services, laboratory and x-ray services, and home health care. Optional care like prescription drugs, case management, and physical and occupational therapy. Medicare supplement plan types. There are many different supplement plans. This chart shows you what the different plans cover. Plan F, G, and N are the most common used. Plan F is called the Cadillac plan. It pays everything that Medicare A and B do not cover, but it is very expensive. Plan G is sold by insurance companies and is the middle tier plan. It is the one most people use. Plan N is used by people who are still in fairly good health, usually at no extra cost. Review of coding CPT, ICD, and HCPCS. Why we code. We need to be very specific. There is a vast amount of medical data that needs to be reported in order to be reimbursed. We use uniform documentation between medical facilities, government, and health agencies. There are 3 types of code we use. ICDs, diagnostic code, that create a uniform vocabulary for describing the causes of injury, illnesses, and death. They represent a doctor's diagnosis and patient's condition. They are used to determine medical necessity. We use ICD 9 CM or ICD 10 CM. The CM means clinical modification, a set of revisions made by the NCHS, a division of Medicare and Medicaid. These give coders more flexibility and specificity. CPT, current procedure terminology. They document the majority of the medical procedures performed in a doctor's office. It's a 5-digit number code. AMA published and maintained by. Updated annually. It has 3 categories. Category 1, Evaluation Management, consists of anesthesia, surgery, radiology, pathology, and laboratory and medicine. Category 2, corresponds to performance measurement. It's added to the end of a Category 1 code with a hyphen, specifically related to a performance of healthcare professionals and health facilities. Category 3, corresponds to emerging medical terminology, a CPT modifier, 2-digit numeric or alphanumeric code added to the end of a Category 1 CPT code, provides important information to the procedure code. Healthcare Common Procedure Coding System, a set of codes based on CPT codes for Medicare and Medicaid, developed by the CMS and maintained by the AMA, primarily correspond to services, procedures, and equipment not covered by CPT codes. Examples: durable medical equipment, prosthetics, ambulance rides, and certain drugs and medicine. Also, the official code set for outpatient hospital care, chemotherapy drugs, Medicaid, and Medicare. It has 2 levels. Level 1, identical to CPT codes, but send to Medicare, Medicaid. Level 2, alphanumeric codes divided into 17 sections based on specificity. Example: medical and laboratory or rehabilitative services. Like CPT codes, each HCPS code should correspond with a diagnostic code that justifies the medical problem and covers procedures and equipment not covered under the CPT. 8 key areas of medical accounts receivable. The objective of doing accounts receivable correctly is to get payment in the shortest time possible. You need to know how each department in the medical office works. Number 1, legal concepts. You need to understand and follow all state and federal regulations. You need to prevent the practice from fraud and abuse. Most commonly is upcoding and unbundling for services not rendered. Number 2, contract negotiation. Is a developed financial relationship with the managed care organizations, which make up to 50% of the net revenue of most medical offices. Negotiating these involve comprehensive knowledge of contracting processes, which include reimbursement rates, effective and termination dates, claim filing guidelines, payment terms, and other contract provisions. Each medical office has their own strategy for their office. Know the percentage that Medicare, Medicaid, Cigna, Blue Cross Blue Shield, Aetna, United Healthcare, or the uninsured. Understand the payment methods that they provide while negotiating. Hire a consultant to do the negotiating because of the complex nature of contracts and legal aspects. Always contact our legal counsel when issues arise with a contract issue when it is beyond the scope of expertise of the medical office leadership. Number 3, compliance. We have a compliance policy and medical code of conduct online to refer as a guide to ethical and legal concepts. Our compliance program is in line with the Office of Inspector General. A. Conducting internal monitoring and auditing. B. Implementing compliance and practice standards. C. Designating a compliance officer or contact. D. Conducting appropriate training and education. E. Responding appropriately to detective offenses and developing corrective actions. F. Developing open lines of communication. G. Enforcing disciplinary standards through well-publicized guidelines. Number 4. Patients' rights. The U.S. Office of Personnel Management points out 3 objectives for patients' rights. The first one, strengthen the confidence of consumers that their healthcare system is fair and responsive to their needs, concerns, and improving and ensuring their health. The second, reaffirm the strong relationship between patients and their healthcare professionals. And the third one, reaffirm how consumers play in safeguarding their health by creating the rights and responsibilities to improve their health status. The 8 areas we apply patients' rights in this medical office. Number 1, patient information. Number 2, choice of providers. Number 3, access to emergency services. Number 4, informed consent. Number 5, respect and non-discrimination. Number 6, confidentiality. Number 7, complaints and appeals. Number 8, patients' responsibilities. To be active in their care and treatment, resolution of their financial responsibility, and respectful interaction with the medical staff. Number 5, patient access. How the front desk performs. How they collect medical information, including insurance information, which helps the billing and collection performances. This is an issue when the employees don't have adequate training, lack of staff, and lack of proper resources. Number 6, charge capture. Is the responsibility of every department in the practice by accurate documentation and charge capture, including linking medical codes for services and procedures, timeless coding and accuracy of billing. For ambulatory care, case management, critical care, laboratory, maternity, medical, surgical unit, mental health, nuclear medicine, pain management, pediatric, pharmaceutical, physical therapy, radiology, and wound care. Number 7, health information management. Health information management is the process of maintaining, storing, and retrieving patient health information in accordance with acceptable federal, state, and accrediting agencies' requirements. There are 10 responsibilities within the framework of health information management. Number 1, medical coding. Number 2, medical transcription. Number 3, medical necessity. Number 4, medical staff support. Number 5, assembly of medical records. Number 6, maintenance of medical records. Number 7, filing and retrieval. Number 8, privacy and security. Number 9, release of information. Number 10, maintaining confidentiality. Number 8, patient financial services is the responsibility of the billing and collection department of the account receivables of the medical office. You as the medical biller need to have complete knowledge of the insurance payers and the laws and regulations of the healthcare industry. You need to submit the medical claims to the insurance companies, including physician offices, hospitals, nursing homes, and other healthcare facilities in a timely manner. You must follow up on claims so the practice gets reimbursed in a timely manner. These 8 areas of accounts receivable are the essential for the success of our practice.